Welcome back, folks. Thanks for tuning in to our educational series where we're breaking down the intersectional relationship between reproductive and environmental justice. Today's conversation will center on the health impacts and risks stemming from the ongoing climate crisis. Our communities, especially in rural areas, face significant challenges due to greenhouse gas emissions, poor air quality, and climate-related events. Droughts, wildfires, and flash floods affect not only our physical health, but also our mental well-being and housing security. Acknowledging eco-grief and the necessity of mental health support is crucial in New Mexico as we face rising temperatures and increasingly erratic weather patterns in a rapidly warming environment. The consequences of greenhouse emissions extend far beyond rising temperatures and extreme weather events. Greenhouse gases and air pollutants trap heat in the atmosphere, leading to increased air pollution, aggravating respiratory issues like asthma, chronic obstructive pulmonary disease, and lung cancer. In fact, the World Health Organization estimates that air pollution caused 4.2 million premature deaths worldwide per year in 2019. According to the American Lung Association's 2025 State of the Air report, a staggering 156 million people in the U.S. live in areas with failing grades, making for unhealthy levels of ozone and particle pollution. Particle pollution itself is a cause for strokes, more ER visits, early death, and heart attacks. Communities of color and low-income families are most disproportionately affected. People of color, who make up 41.2% of the U.S. population, account for 50.2% of those living in counties with poor air quality. Hispanic individuals are particularly affected, being nearly 3 times as likely as white individuals to reside in areas with severe air pollution, heightened by 3 failing grades. While New Mexico has shown some improvements in our air quality, we still have a long way to go. 51% of New Mexicans still live in counties with at least 1 failing air quality grade, and 32% reside in areas that fail on all 3 measures. Eddy County, which lies in the heart of the Permian Basin, is ranked 15th in most polluted counties in the U.S. for ozone pollution. As temperatures continue to rise, the increased risk of heat-related illnesses and severe discomfort also rise. The impacts of rising temperatures also contributes to feelings of stress, anxiety, and depression among community members, exacerbated by existing social and economic stressors. Indigenous communities face cultural loss and psychological distress as traditional landscapes and livelihoods are threatened. Affordable housing units may lack adequate cooling systems, exposing residents to heat stress during extreme heat events. This often leads to displacement and migration, forcing communities to relocate due to these extreme weather events, resulting in feelings of loss, trauma, and social isolation. A study by the American Psychological Association found that nearly 51% of Americans experience stress related to environmental issues. The emotional burden is particularly heavy for vulnerable populations, such as children, the elderly, and those living in poverty. Increased incidents of domestic violence, hate crimes, and child abuse have also been linked to rising temperatures and climate disasters. A study conducted by researchers at the University of Cambridge found that following climate disasters such as Hurricane Katrina, incidents of sexual and domestic violence increased for nearly a year. The LGBTQ+ community was targeted in the storm's aftermath and was prevented from receiving aid or accessing shelters. Furthermore, studies have found that hate speech and online bullying also increased during incidents of temperature extremes, contributing to racism, sexism, harassment, and threats. Addressing the impacts of severe weather and rising temperatures requires a holistic approach that integrates climate resilience, social equity, and mental health support. Strategies such as investing in sustainable housing infrastructure, improving access to healthcare and mental health services, and enhancing community resilience are vital. Initiatives like investing in clean energy infrastructure, promoting sustainable land use practices, and supporting mental health and community resilience programs can all pave the way for a healthier future. By embracing these measures, we can take meaningful steps toward creating a sustainable and equitable New Mexico where everyone can thrive.